Dr. Frank Ulrich Montgomery, president of the German Medical Association, president of the World Doctors Federation, argues that lockdown measures, as in Italy, are unreasonable and counterproductive and should be reversed. He says Italy has imposed a lockdown and has the opposite effect. They quickly reached their capacity limits, but did not slow down the virus spread within the lockdown. A lockdown is a measure of political despair because coercive measures mean that you can go further than the generation of reason. Next, Professor Pietro Vernazza, MD, Chief Physician of Infectious Disease, St. Gallen Cantonal Hospital, found that around 85%, this is the guy, 82 to 90% of all infections occurred without anyone noticing the infection. He's the one that's saying we have a huge asymptomatic carrying body. He says, based on the new insight, we also have to understand that many of the measures that we have implemented so massively today may even be counterproductive. Next, Dr. Shukarit Bhakdi, MD. I'm sure I am really beating up these names, but that's not the point. Microbiologist, former professor at Johann Gutenberg University in Mainz, former head of the Institute for Medical Microbiology and Hygiene, one of the most cited research scientists in German history. We are afraid, he says, that 1 million infections with a new virus will lead to 30 deaths per day over the next 100 days. But we do not realize that 20, 30, 40, or 100 patients positive for normal coronaviruses are already dying every day. The government's anti-COVID-19 measures are grotesque, absurd, and very dangerous. The life expectancy of millions is being shortened. The horrifying impact on the world economy threatens the existence of countless people. The consequences on medical care are profound. Already services to patients in need are reduced, operations canceled, practices empty, hospital personnel dwindling. All this will impact profoundly on our whole society. All these measures are leading to self-destruction and collective suicide based on nothing but a spook. Next, Dr. Wolfgang Wodarg, MD, German pulmonologist. This guy's gigantic, former chairman of the Parliamentary Assembly of the Council of Europe. In 2009, he called for an inquiry into alleged conflicts of interest surrounding the EU response to the swine flu pandemic. He says politicians are being courted by scientists who want to be important to get money for their institutions, scientists who just swim along in the mainstream and want their part of it. And what is missing right now is a rational way of looking at things. We should be asking questions like, how did you find out this virus was dangerous? How was it before? Didn't we have the same thing last year? Is it even something new? That's missing. Next, Dr. Joel Kettner, MD, professor of community health sciences and surgery at Manitoba University, former chief public health officer for Manitoba Province, medical director of the International Center for Infectious Diseases. I have never seen anything like this, anything anywhere near like this. I'm not talking about the pandemic because I've seen 30 of them, one every year. It is called influenza and other respiratory illness viruses. We don't always know what they are, but I've never seen this reaction, and I'm trying to understand why. Next, Dr. John Ioannidis, member of the National Academy of Medicine, professor of medicine of health research and policy of biomedical data science at Stanford University School of Medicine, professor of statistics at Stanford University School of Humanities and Sciences, director of the Stanford Prevention Research Center, and co-director of the Meta Research Innovation Center at Stanford, editor-in-chief of the European Journal of Clinical Investigation, former chairman at the Department of Hygiene and Epidemiology, the University of Ioannina School of Medicine. He says patients who have been tested for SARS-CoV-2 are disproportionately those with severe symptoms and bad outcomes. As most health systems have limited testing capacity, selection bias may even worsen in the near future. The one situation where an entire closed population was tested was the Diamond Princess cruise ship and its quarantined passengers. The case fatality rate there was 1.0%, but this was a largely elderly population in which the death rate from COVID-19 is much higher. If we do not know about a new virus out there and had not checked individuals with PCR tests, the number of total deaths due to influenza-like illness would not seem unusual this year. At most, we might have casually noted that flu this season seems to be a bit worse than average. Hardly terrifying testimony. Dr. David Katz, MD, founding director of the Yale University Prevention Research Center. I am deeply concerned that the social, economic, and public health consequences of this near total meltdown of normal life, schools and businesses closed, gathering banned, will be long-lasting and calamitous, possibly graver than direct toll of the virus itself. The stock market will bounce back in time, but many businesses never will. The unemployment, impoverishment, and despair likely to result will be public health scourges of the first order. Next, Dr. Dan Yeaman, PhD, infectious disease modeler, former faculty member, Center of Infectious Disease Modeling Analysis, Yale University. Are you getting the picture yet? I'm going to keep going, but are you getting the picture? The actual number of people who are sick with the virus in South Korea is at least double what's being reported. So the chance of dying is at least twice as low, standing at about 0.45%, very far from the World Health Organization's global mortality figure of 3.4%. And that's already a reason for cautious optimism. We're getting there, folks. I just want to talk about, remember, Chris Cuomo just told you on primetime news, nobody supports removing or ending a quarantine or lockdown, yet every one of these scientists is telling you this is an incredible overreach. We should not be doing this. I've got a few more. Let's look at this. Not yet. I want to see the study. Bring up the study. Hold on. We got a lot of slides, and I have a team, very small team, attempting to make this all make sense. Here we go. This is really important because here's multiple scientists now all involved in a paper written at Science Direct. This is what they went on to conclude and say. Didier Raoult being one of them. In OECD countries, the mortality rate for SARS-CoV-2 1.3% is not significantly different from that for common coronaviruses identified at the study hospital in France. The problem of SARS-CoV-2 is probably overestimated, as 2.6 million people die of respiratory infections each year, compared with less than 4,000 deaths for SARS-CoV-2 at the time we wrote this. And what they're saying is, look, we have always had people dying of coronaviruses. We're the experts of the world. We've been monitoring it. We've been watching it. We know it's there. It's always been within some sort of safe, acceptable region. In fact, look at this study that came out in 2006. This is fascinating. An outbreak of human coronavirus OC43 infection and serological cross-reactivity with SARS coronavirus. This is what this went on to say. We have characterized an outbreak of respiratory illness due to this. Remember, this is a totally different coronavirus, the HCOV OC43. The observed attack rate of 67% and case fatality rate of 8% underscore the pathogenic potential of coronaviruses in frail populations. This adds to other observations underscoring that CoVs, other than SARS-CoV, may be responsible for a broader spectrum of disease than coryza alone. These findings underscore the virulence of human CoVs in elderly populations and confirm that cross-reactivity to antibody against nucleocapsid proteins from these viruses must be considered when interpreting serologic tests for SARS-CoV. Now, this study is saying all the way back in 2006, we have a high death rate amongst the elderly with just a common coronavirus right then. You see, this has always been happening. And what we're doing is we're overly focused on an event. We just never spent time looking at it. We're overly focused on it and making a dramatic event is what it looks like these scientists are saying. It's certainly what they're saying in the study and the list I've given you. Let's look at Professor Yoram Lass, former health ministry chief of Israel, former associate dean of the Tel Aviv University Medical School. He says that the new coronavirus is less dangerous than the flu, and lockdown measures will kill more people than the virus. He adds that the numbers do not match the panic, and psychology is prevailing over science. He also notes that Italy is known for its enormous morbidity in respiratory problems, more than 3 times any other European country. He's telling you their hospitals are terrible and they are not the healthiest people. And this, one of really, Dr. Gutcha, founder of the Cochrane Collaboration, who has been investigating scientific fraud worldwide for decades. This is a brilliant scientist. He's published more than 75 papers in the BMJ, Lancet, Annals of Internal Medicine, and New England Journal of Medicine. All right? This guy will never want to lead anyone astray. I guarantee you he has no goal to put people in harm's way. Look what he has to say. On the 8th of March, I published in the BMJ about this. I wrote, what if the Chinese had not tested their patients for coronavirus, or there had not been any test? Would we have carried on with our lives without restrictions, not worrying about some deaths here and there among old people, which we see every winter? I think so. He goes on to say, I believe we have other quotes. Almost everyone I talk to, lay people and colleagues, I am a specialist in internal medicine and have worked for 2 years at the Department of Infectious Diseases. All of my colleagues and friends consider the coronavirus pandemic a pandemic of panic more than anything else. The WHO estimates that an influenza season kills about 500,000 people, or about 50 times more than those who have died so far during more than 3 months of the coronavirus epidemic. Should it turn out that the epidemic wanes before long, there will be a queue of people wanting to take credit for this. And we can be damn sure draconian measures will be applied against again next time. But remember the joke about tigers. Why do you blow the horn? To keep the tigers away. But there are no tigers here. There, you see? Those are the scientists around the world. They are jumping ship from what we are being told by Dr. Fauci and the CDC and the World Health Organization. Usually all of these people are aligned, but clearly somebody, somewhere, has jumped out so far ahead of this thing that these scientists have said, I'm not a lemming, I'm not walking off the cliff with you, and I'm certainly not going to risk my reputation by continuing on with what it appears from their language to be a fraud against humanity. How is it all of these scientists could be so sure of themselves? How is it they are putting their gigantic reputations on the line as we speak to potentially put people at risk, saying these are draconian measures and they must be stopped? They have nothing to do with stopping this illness. This illness is a nothing burger. All of them are risking their careers to say that.